Our guest on this episode is a recognized thought leader in healthcare innovation and public health practice. He joins us to share his fascinating journey on this episode. You're listening to the PHEC podcast, episode 352. The field of public health is so broad, overlapping multiple industries. With epidemiology at the core of public health, there are an unlimited number of ways to target specific populations, health conditions, environmental issues, and causes that matter most to you. My name is Dr. Huntley, and I'm the host here on the Public Health Epidemiology Conversations podcast. I'm an epidemiologist, consultant, and entrepreneur with over 20 years of experience in healthcare and public health. On this podcast, my guests and I engage in conversations that demonstrate the importance of public health and epidemiology across a variety of industries, helping you think outside the box and inspire greater positive impact in communities around the world. Now, let's dive into the topic of this brand new episode. Greetings, everyone, and thank you for joining me on this episode. Whether this is your first time tuning in or you're a regular listener of the podcast, I'm happy that you're here. I'll briefly introduce or reintroduce myself and tell you a little bit about what I do, and then I'll introduce you to our guest. I lead a public health and epidemiology consulting firm that supports large nonprofit organizations and government agencies that serve Black, Indigenous, and people of color, commonly referred to as BIPOC communities. We are often invited to support tribal organizations and are always humbled and excited to serve. We help our clients communicate their data and health information in plain language to the communities they serve. Now, this type of support builds trust. It strengthens relationships between organizations and individual community members. Some examples of the support that we provide include comprehensive toolkits, fact sheets, custom reports, community health profiles, as well as data-driven workshop facilitation that engages community leaders on specific disease and health-related topics that are most pressing within that community. Now, if your organization serves BIPOC communities or is genuinely interested in building relationships with BIPOC communities, then please reach out to us on our website, drchuntley.com, and we'd be happy to meet with you and explore how we might be able to support your organization. Now, the links will be also provided to you in the show notes. Now, in this episode, my guest is Dr. Stephen Martin, who is a recognized thought leader in healthcare innovation and public health practice. We discuss some very relevant innovation at this intersection of information technology and public health that may be ideal for your agency. You may be listening to this conversation in just a moment and thinking, this is exactly what we need. It may be for your agency, health department, or nonprofit organization. I first heard Dr. Martin speak about this with some of his colleagues. It was during a webinar, and I immediately invited him to be a guest on this podcast. I'm excited for you to meet him. So let me formally introduce my guest, and then I will connect our conversation. Dr. Stephen Martin serves as Executive Director of the Creating Pathways and Access for Student Success Foundation. Also in a dual role, Dr. Martin serves as a subject matter expert for Quant 16's Health and Human Services practice. Recognized as a thought leader in healthcare innovation and public health practice, Dr. Martin has previously held the position of President and CEO of the Accreditation Association for Ambulatory Healthcare, Executive Director for the Association for Community Health Improvement at the American Hospital Association, Chief Program Officer for the Health Research and Educational Trust, Health Commissioner and COO for the Cook County Department of Public Health, and a member of the Cook County Health and Hospital Systems C-suite executive team. Dr. Martin's health career spans 20 plus years with key contributions in public health leadership, emergency preparedness, public health, community benefit, quality and accreditation, care delivery for vulnerable populations, health policy and advocacy, health insurance, and data analytics. Further, his public health background includes serving as the co-chair for the Illinois Governor's Office of Health Innovation and Transformation, Population Health Integration Work Group, a peer reviewer for the U.S. Department of Homeland Security Grant Program, and a member of the Illinois Department of Public Health, Local Health Department Executive Advisory Group for Emergency Preparedness. Now, in addition, his health commissioner tenure included participating in the top-off 2 U.S. National Combating Terrorism exercise, leading local health responses to and planning for the H1N1 pandemic, swine flu pandemic, West Nile virus outbreak, monkeypox virus outbreak, and SARS coronavirus outbreak in Cook County, Illinois, and deploying the first electronic health status surveillance system in the state of Illinois. Also, his professional board experience includes service on the following boards: Zing Health Incorporated, Council on Education for Public Health, Hospital Charitable Service Awards Board, State of Illinois Maternal and Child Health Advisory Board, Suburban Cook County Tuberculosis Sanitarium District Board, Suburban Primary Health Care Council, and Northern Illinois Public Health Consortium. Dr. Martin holds a bachelor's in biology and a master of public health and epidemiology from Tulane University and a PhD from the University of Michigan in epidemiologic science with a focus on environmental epidemiology. Dr. Martin trained at the National Institute of Environmental Health Sciences as an intramural research training award fellow and was recognized for outstanding graduate research at the National Institutes of Health. He was certified as a lead abatement supervisor in the state of Illinois and has published several peer-reviewed articles. Dr. Martin is a member of the American College of Healthcare Executives, American College of Epidemiology, American Public Health Association, Society for Epidemiologic Research, Council of State and Territorial Epidemiologists, and the International Epidemiological Association. He is a fellow of Leadership Greater Chicago and the Institute of Medicine of Chicago, and a member of the U.S. Environmental Protection Agency's National Advisory Committee and several other boards and committees. He serves on the faculty at the Texas A&M University School of Public Health and the University of Illinois at Chicago School of Public Health. Let's connect my conversation with Dr. Martin right now. Well, Dr. Martin, welcome to the podcast. We've been chatting for a little while before hitting record, but it's really nice to have you here. Welcome and glad to jump into this interview. How are you doing?
Doing well, and thank you for having me. Look forward to sharing a little bit about what's this word epidemiology and how I got here.
Right. Right. Yeah. So I have so many questions. Just naturally, I'm just inquisitive. I love to learn about the path and the journey and the work that you're doing, especially when I get an epidemiologist on the chat with me. This is just so much more fun to kind of dive into all the nuances. My audience is probably going, okay, she's going to probably geek out over some of this stuff right now. But before we dive too much into what you're doing right now, we're going to kind of travel the journey forward from where you started up here. But to kick it all off, why don't you just introduce yourself and tell everyone a little bit about who you are?
Wonderful. Again, Dr. Stephen Martin. I am the executive director for the CPASS Foundation, as well as a subject matter expert for the Health and Human Service practice for Quant 16. And that is what I do at the moment. And prior to that, I could just jump right in and just back up, but I'll take your lead.
Okay. A lot of good stuff in here. So I think that you are wearing some really important and interesting hats. And I definitely want to know more about Quant 16. Just to put into context, we were introduced to a mutual friend in common. And then I attended a webinar where you were talking about resources through Quant 16. And we're definitely going to dive into some of that. So yes, it feels like we have so much to cover. But before we get into any of it, let's go back to one of my favorite questions to ask my guests on the podcast is this one. When did you first learn about or become interested in public health as a career?
It's not a straight line story. And I would love to find a colleague that had a straight line story that when they grew up, they wanted to be an epidemiologist in public health. I would pay to see that story. But my story started with, I think at the time period when I was in neuro school, a lot of my peers were looking to either add to their resume or looking to polish their academic record before they would go on to medical school. And here was this word public health. And for me, I was going through my studies at Tulane University and completing my undergraduate degree in biology. And I was looking at the health field. I wasn't sure where I wanted to exactly land. I thought my pathway was to medical school. But then there was a good friend of mine who was a year ahead of me who said, you know what, Stephen, I want to introduce you to Dr. Antonio Rene. And I said, okay, no problem. You know, I'm a junior at this point. And so I set a meeting and had the opportunity. And he was the first epidemiologist I met. He was a Black male epidemiologist at Tulane University, a professor. And a lot of long stories, but I'm going to try to shorten them up. He said, you know what? It's better that I show you than tell you. And he said, I want you to add an intro epi course to your senior year and see if that really excites you. I had some general interest in what he was sharing, but I don't know if I was, growing up, I was like, epidemiology, are we studying the skin? What is this? And so I took the class, and I think that it was the proudest, I'll say it this way, it was the proudest A I ever got in a science class through my entire undergraduate career, and came out of that, you know what? I'm not sure where my landing spot was going to be, but you know what? There's an opportunity to pick up a master's degree and really get my feet wet, sort of say, in the field. And so there you go. That just launched into my journey into epidemiology. And in a little bit that I later learned that Dr. Rene and I are now very good friends. So it went from professor student to mentor to mentee to advisor when I moved on to my doctorate degree to advisee to now a peer-to-peer, and now as he's retired, a true friendship and brotherhood. And so in our talks now, it was, Stephen, I was back in my mind, I had a plan. I was never going to let you go to medical school. I was going to make you get your doctorate degree in epidemiology. But with that, he set in motion what conferences I needed to go to expose myself and open myself to meet other public health professionals. It was the type of courses that I was going to get into. And here's kind of the beginning of the connection of Quant 16. So we're going to get to that, but this is the little nugget here. So he said, I want you to get on to this grant project. Another colleague had an NIH R01 grant, and, get on that grant and start to work as a data analyst. But that was my first foray into being in the grant world and at the line level. So I'm just going to set that. I'm just setting that up to the conversation of Quant 16. So from there, I went on to meet some phenomenal individuals. His name escapes me, but I know he was the first Black director of the National Institutes of Environmental Science, one of the NIH jewels. And I met at the American Public Health Conference. And I just went up to him and introduced myself. And he said, hey, Stephen, why don't you, I'm still a master's student, why don't you come and sit down and have lunch? And I was like, okay, we're going to have lunch. So I get back to Tulane and I tell Dr. Rene, I said, Dr. Rene, I met this gentleman and he said, whatever I do, try to do a summer internship at his institute. He said, do you know who you met? And I said, well, no, not really. I said, you met one of the NIH directors and you met the only Black NIH director at that time. I was like, oh, wow, okay. So through that, we continued my studies, had the opportunity, let me put my family piece into this. So my family was not my immediate family, was not necessarily knew I was in health. They didn't know exactly what was epidemiology, but I found that epidemiology allowed me not to pick a side. And what I mean by that is my father was a certified public accountant. So there's the numbers. Okay. Mm-hmm. And my mom, in the time in the South, you only need a diploma to practice nursing at that time period. So here I had the combination of health and numbers. So I didn't have to pick a side. So I was just, right. So my sister's always you were always the non-conflict person. So you pick this profession that really brought these two worlds together, health and numbers. So my Mead family kind of got it. They were like, okay, we get what we're doing.
Wow, that's kind of neat.
Yeah, it's all this epidemiology. Now, the rest of my family was like, okay, after you had to get to the conversation of, are you dealing with the skin? That part.
Right. Yeah.
There you go. And so that set me on my path. But later on, part of my father's story is that one of the things that he professed to his kids was whatever field you went into was to get your terminal degree. And so myself and my two sisters, we always knew we were going to get our terminal degree. It was beaten into us in a good way, but that was one of the things that he shared with. So I knew my next steps, and the folks that Dr. Renee had put into my universe kind of set those things in motion. And then was blessed to have the opportunity to attend the University of Michigan on a fellowship and to meet my next phenomenal advisor, Dr. Siobhan Harlow, who just literally picked up the reins. It's like these two never met. I think they've talked, but I don't think they've ever been in the same place at the same time. But it was literally felt for me, my advisor relationship did not stop. There was no break-in point. I went from this phenomenal master's guidance and stepped into a doctoral program that was already really polished, and an advisor who helped me navigate at that time period. Still, you were one of one at that time period. So went on and finished at Michigan. But then that's when NIH comes back into the story, that as soon as I completed, as you know, complete your coursework, the next round is to do your doctoral research. Mm-hmm. Well, I had done a summer at NIEHS, met some phenomenal epidemiologists there in the epidemiology branch who were just really great, and really great memories there. But that set in motion gave me the opportunity that they considered me as a fellow for an NIH intramural fellowship. And as you know, you can, most of the times when I'm telling students, always think about, once you get your doctorate degree, there's one more piece you really should give serious consideration on, depending on life and family, that you should think about a fellowship, a postdoc fellowship. My story started with, I had a pre-doctoral fellowship. So I was doing the pre-doctoral fellowship during my time. So as soon as I did my coursework in Ann Arbor, was there in Research Triangle Park, North Carolina. And here's the next part of this grant story that connects to quant. Now I went from on the line staff of being in the grant to now becoming actually leading my own research project as a project lead there at NIEHS. And so I completed my research and then walked and got my papers from Michigan. And there you go. That's my epidemiology journey. But I look back that I now know why I was supposed to do the pre-doc and such. So let me stop there, take a break, and see what you got.
No, that's really interesting. It's starting to kind of connect based on, I know everyone's curious, like, what's Quant 16? We're getting there.
Yeah.
So I'm curious also because you spent some time at Cook County. Tell me about that role.
Well, that's what this kind of teaser I was setting up, that had I done a postdoc fellowship, I look back, I would not have met my wife. I would not have lived in Chicago, and would not have had the opportunity to meet one of the significant political pioneers in the city of Chicago, the county board president at that time, President John Stroger. And so he saw this young man who was an epidemiologist with a doctorate degree. And I think that he wanted to refresh. He's long past. I'm going to assume that he wanted to shake it up a little bit, and said, hey, he asked me to come and work at the Department of Public Health. And then he said, you know what? The commissioner was retiring after a phenomenal 14-year service that she had. And he said, you know what? I'm going to appoint you as health commissioner for Cook County. And what a phenomenal blessing. And that was at 29. And so most of our career time, we spend the time building our professional network so that when we get to these roles, that we have that support system around us as we go in. And as I'm talking about leadership, when I'm asked to talk about executive leadership, one of the things I share with them is that it's so important to have that circle around you, because guess what? When I went in literally where I was this baby among public health leaders nationally. And so I couldn't connect on my professional growth, I'll call it that way, with them because many of them were already through many of the fires. Now, we could connect on the public health issues of the time. That was not the issue. It was just fascinating. So I sit here and say, I look back, it's like, oh, I see I was never supposed to do a postdoc. That somehow in my journey that our good maker said that, I wanted you finished and done. Because you will never, here's a fun part, you will never practice epidemiology. So I came out and now I am right into leadership and developing my executive CV from that standpoint, and then went on. So I've done from there, did a phenomenal tenure with a phenomenal team there. And I'm really proud because I'm at this age and I'm watching some of my deputies now who are stepping into their own commissioners. And I'm like, I'm way too young to have this alumni group, no way. But I'm so proud of them. It must have meant that I brought something to the table and maybe there were some nuggets of truth that they listened to. But went on, studied there, did that tenure there, and then went on, did time as a chief program officer at the American Hospital Association. I did another executive leadership role at Accreditation Association, and then healthcare consulting. But along that way, I met the team at Quant 16 in my travels there in Chicago. And they got to know me as, I would sit here and say, a true health and human service professional. And when I left the county, asked me to contribute when they had these really technical engagements that required a different way of thinking. And really, that's where I found epidemiology most helpful in my leadership, because you and I, today's buzzwords is data-driven decisions.
Right.
And I didn't know what that was called back in 2000. We weren't calling it that in 2000, but I was already doing that. I mean, I came out of a world where data-driven decisions was our world. And so it made my management style somewhat in alignment of where the movement was going to eventually land, where we are now. You always hear these words, data-driven decisions, metrics, and all of that. Well, as an epidemiologist, one, I knew that world. And I also knew how to read when my staff and my team would bring those issues, those problems to the table, that if I chose to, depending on what the management style needed at the time, either get very granular or really technical, and carry the conversations with other epidemiologists or with policy folks to think not today, but let's apply the confidence interval to what we're about to do in a way. So I really am grateful for my training, because you wouldn't think that, because some of my things is in talking about public health and talking to students, if you're planning to go down in the executive track, you may want to consider either taking a management course or picking up a business degree. Because what is not natural in public health leadership is thinking about it is a business, most of the job. And then the rest of the job is actually public health practice. But you still got to keep the lights on. You still got to be accountable. And so just the way I approach my work, I think that's where the Quant 16 said, you know what, when we're doing health and human services, or we're now as a health commissioner, I was both a grant recipient and a grant funder. So I keep developing this grant administration technical verse behind myself, that they felt, hey, you know what, we need your contributions when we get these really sophisticated engagements, that we need to bring some real credible expertise to the table. So that's my journey. Held a little bit about Cook County, and then my world now. I spend my time, it's about leadership, thinking about healthcare workforce, and some other stuff.
That's really great. And I'm listening to you, and it really resonates so strongly with me, because I remember a time when I thought I was going to just hang up this whole epidemiology, this whole public health thing, and move to something else. I spent 10 years or so in healthcare and then transitioned to public health. And I had so many bright ideas. I was excited about what I was learning, and I was working in the State Department, and I wanted to implement, let's talk about some of this. And it was like shut down. Like, my supervisor made it very clear. She was counting down to retirement, and we were not going to rock the boat. She didn't want to hear about my bright new ideas. And that was like, talk about wet blanket. Fast forward, when I started, I went to commercial industry and started getting creative, have a bit of a, it's sort of business background from family. That's just where my family That's what a business meeting on a Saturday afternoon is what it was. It looked like a cookout, but, they could be mapping out, what they were going to start next. And so I enjoyed these conversations where, talk about non-traditional partnerships. I have had so many really engaging conversations with industries like IT and people that are looking to create these solutions. And they really do want to hear about these innovative and creative ideas. They want to understand something. I think that's where we can do our best work in public health, is kind of opening up to having these kind of conversations and partnerships and collaborations. Those are the things that are going to move us forward in the strongest sense. I do love hearing data-driven solutions all the time. I was like, isn't everybody doing that? So that's really good. So let's jump into this mysterious Quant 16. What is this organization?
So Quant 16 actually, and it's a new name for the organization. Prior to that, so formerly it was EKI Digital. And it's a digital technology firm that is focused on just enhancing both public and private organizations. They bring those technology solutions to support their work. And so just an extraordinarily forward-focused team that is not standing still. And one of the things that in the health and human service practice is really, as you know, it's the grant world. So bringing that grant expertise is, of course, is always measured in your outcomes and hitting your budget totals. But as the pressures are coming, we tell folks flat funding is actually a cut. And so don't celebrate that. Or if there's a clawback, which is happening particularly at the federal level, where the feds say, okay, you've not obligated all of your funding. We're going to take some of that back in because obviously you don't need it. That it puts the pressure on those executives to really think about how do they approach their work? Do they have the right data in front of them? And do they have the right team to support to give them that data? So here at Quant 16 and our firm, we really leaps and bounds ahead in terms of thinking about, well, we know AI is here. And I tell some of my public health leadership colleagues, don't shy away from it. I say to them, I've done the moaning and groaning for you. Let's put that to the side because all your emotions, your feelings about what is this? This is going to take over the world are very valid. But unfortunately, in the case of AI, it is all within a lot of the things of our daily world. So what we have set out is how do we utilize this tool in the work of particularly grant administration from local to state municipalities and government agencies across the board and even private sector? How do we add this tool to the menu to both be more efficient and drive data-driven decisions? And in the case of grant administration, you have, which is phenomenal, we have a low unemployment rate, which is, that is public health. Health is jobs, health is economy.
Right.
But with that, in our space is, do we have the competitive salaries to get that talent, keep that talent, retain that talent? Because definitely, at least my colleagues in the public sector are not giving out bonuses. That's not the world. So giving those kind of pressures, how can we utilize technology to support those operations? And here at Quant 16, not only thinking about how AI approaches grant administration to support the executives in their managerial duties. So the expectation is deliverables, the reports, the budgets, but also having visual on those problems that may arise. And so one of the things that I remember and working and I'll finish this thought with Quant 16. So working with the team to actually, how do we develop different solutions that help in that grant administration? And so we've done that and we stand ready to help those organizations. It's not about replacement. It's about incorporating that tool into the body of work. And so one of the things I remember back in 2000 with our grants is we had some line level epidemiologists in the finance division. So you had one person there, you had the team, the program team. Everybody had Excel sheets. And so when I would ask for something, you would have to pull teams together and stop everything and put these Excel sheets to actually either know where you were with the grant, were you spending down your indirect, were you obligating those funds so you can avoid the clawbacks. And so our technology solutions weren't necessarily coalescing all of that data in the right kind of way to actually produce a live, click on the button as an executive the call from the county commissioner in the District 3. I'm making this up, of course. How much are you spending in my district? And I would have to stop the policy team, the program team, the finance team, maybe the chief medical officer, that we had to get this number all correct. And so that's a lot of people, a lot of talent just sitting there. Now, fast forward now, what Quant 16 has done is say, you know what, we can bring all those data points together, and AI can really now in real time really drive these generation of reports. Or you as an executive leader, click on that button and that report's right there on your desk in a very different way. There are grant management softwares and they're very good. But again, they don't get to the nuances. And that is where I share with my colleagues, there's now technology to help manage the nuances there that, yeah, you're spending money on this, but it can't incorporate the reports from the policy team. The policy team's report combined into a finance report. Then those two documents produce that final report that really gives you the answer. Hey, Commissioner in District 3, this is the answer.
I think that's mind-blowing for me because as a consultant, I have clients of these large organizations that are still shuffling multiple spreadsheets and have also had money taken away because they weren't spending and they didn't really know what they were doing to get to the end of the fiscal year and nobody knows that's still happening. You said back in 1990, 2000, that's happening right now.
No, it's still happening now when I'm asked to send in a couple of engagements and offers and say, it's still there. But what was funny about that webinar, and I had to tell Hollis, I said, now, I'm an epidemiologist about true and true, but I'm going to try to be a comedian and tell this joke. I just hope Microsoft won't be mad. Because I was saying, it's like, nothing against Microsoft, but you got 200 Excel sheets that are all over the place. And you got to sit down and bring them together. And here we are about to eliminate probably 100 of those Excel sheets. And so you say, Stephen, you're going to be fine. You're going to be fine. But I was trying to say it in a way that if it wasn't really for, I'm dating myself. I can't believe I've dated myself. One is when I started epidemiology with Dr. Renee, we were still with Unix and we were just starting with Lotus. Okay. Yeah. I can't imagine doing grant when I got to be a health commissioner, doing grant administration at that time. And this is just relative. So I'm not knocking Lotus, which now was bought by Microsoft, but imagine doing spreadsheets with Lotus at 2000. It wouldn't have been able to handle it. So a lot of work has been done to excel, and that's good work. But again, the pressures now are you can't just go out and hire staff because of the unemployment rate. You're fighting against everybody for that talented staff and then to retain. Mm-hmm. When you are asking for those reports, and when I'm talking to clients on behalf of Quant 16, is that you don't have the resources to stop 5 people to put this together. And it's not that it's not important, but we should be working smarter, not harder. And that's where Quant 16 is forward thinking and bringing these kind of technology solutions to support the organization. Again, the lesson learned as I stood next to Hollis and the team there is technology does not replace the process.
Yes.
And I think that's where an executive goes wrong, because if your manual process, your protocols are already messed up, technology will make it worse. You're adding the Band-Aid onto that. And so it's really getting the process right first, and then understanding how the technology then can support and make you more efficient is a better way of moving through your workday.
I think that's great. I appreciate you for going deeper into this, because this is really what I was hoping to kind of surface and share on this episode. I really wanted my audience to hear this. I know I do have a very diverse audience. So some folks are just kind of learning. This is just good FYI information, but there are some folks that are in these situations we're describing, and this is real, and it's making them think, oh, wait a minute, there's a solution for this now. So I want to make sure that everybody's listening. I'm going to make sure we provide links to connect with Dr. Martin in the show notes so that you can continue that discussion. I'm connecting you all, but I want you to follow up in the show notes, connect with him and schedule a time to kind of chat about the solution. I was really blown away, and I would love for you to learn more about that. This is so much fun. I'm enjoying this conversation. I want to also be cognizant of time. So we just may have to have you back.
Yeah, good on time. But I would say that at one comment, it was interesting. I've been talking to a colleague for about 3 months now, and he was pushing me off on this AI thing. And I've been put in his ear. He listened to the webinar, but he called me this weekend. And he said, you know what? I went to a plenary session on AI. And he came out of it and he says, he said, I was blown away. And then he said, I understand what you're talking about, Stephen. We have to have another conversation, because what I was sharing to you and what we do at Quantum Sustain is that, and for me, I've always tried to think about in public health leadership and practice, really far, far ahead in terms of our management, that if we embrace this technology, one is that we can redirect some of those dollars in better ways. Not to sit there and say we're not doing that. I think that there are opportunities, and that's the key word. There are opportunities, depending on each organization, their size, their sophistication, et cetera. And so I just shared not only with epidemiologists, but our public health community that this AI technology is phenomenal. It's scary. It's phenomenal.
Yeah.
There we go.
Yeah. No, that's very well said. I do appreciate you for coming here and speaking to our audience, our community. I think these are the things that public health as an industry, I really listen closely to where our decision makers are and what they're wrestling with at night and what are they trying to solve. And this is an area that needs to be embraced. Just open up and start having conversations and just be a little bit more open-minded to see what the possibilities are and kind of go from there. So I think we've softened the ground really well with our conversation today. So I can definitely see bringing you back so that we can give it a little time to process.
Yes.
But I do appreciate you. So I have one final question and then we can wrap up. I mentioned, of course, the diversity in our audience. So we now have people listen to the podcast just because they're curious about public health and people can just tune into these conversations and get a better understanding. We've got people from early stage of education, learning and preparing for their degrees. And then we've got folks that are all the way up to the most senior level, in their career. Is there one just bit of advice or a general tip that you could share that could be valuable for our audience, kind of based on what we're talking about here today?
I'll give 2 clips. And I know you've paid for one. One is if I was sharing an undergraduate student when it comes to, as they're choosing their MPH or their doctoral program, the same advice that was given to me, and I think is proven out, is don't pick the school on name, pick the school for the advisor. I'll leave that with that group. When it comes to other executives or professionals, it's really about building your peer support network. It does take work. So having LinkedIn, that's great. We're all connected, but really work on those relationships, because shared experiences help you in growth. And more importantly, you wind up finding you're developing listening skills, because now the defenses are down because you're interacting with folks you trust with. And you find as you continue to develop that listening skills, that when others come along, that sharing some nuggets of information, that you'll be a little bit more open and receptive to walk away, not agreeing, but at least walking away and pondering it and looking it up for yourself to say, you know what, I'm going to check that out. And so that's the 2 ends I would sit here and say for that group and for this group.
That's great. I absolutely agree with what you're saying. Really good stuff there. I say it all the time, so I won't even chime in, but I think the relationship piece is definitely when you seek those genuine conversations, those genuine relationships, and you really want to get to know people. That's a differentiator.
Yeah, when I tell my story about my leadership journey, mine is real. Not that it wasn't bad, but I share with them that, like I said, I was blessed at 29 to step in with no relationships. And if someone asked me, well, would you have traded? I don't know if I would have traded the opportunity, but I would have loved to walk in with my classmate who was an epidemiologist sitting next to me. I mean, he went in as a line epidemiologist in another health department. I went as a health commissioner. We couldn't share the same stories. It's like when my wife told me when I got married. It's like, you got to let your boys go who are not married. You can't listen to them. You got to listen to your boys who are married. And I think that goes true here, is that I sit here and say that, take it from someone who had it on both ends, that I didn't have anything when this leadership role came in, but I worked very hard to develop those relationships. And now I've come to some peace. It wasn't my fault, but it would have been my fault had I not developed those professional relationships, regardless, as I've come to this point in my career.
Thank you. That was great. Really great. I love these stories because there's so many applied lessons right in there. So thank you so much, Dr. Martin. This has been insightful. It's been a lot of fun. I'm going to make sure that we connect the links, like I said, so people can follow up with you, but we'll definitely keep in touch.
Absolutely. Thank you for sharing my story, and maybe someone will one day be an epidemiologist.
That's right. That's right. All right. I really hope you enjoyed that conversation as much as we did. Dr. Martin is an innovative leader and inspiring public health professional. I'm pretty sure we'll have him back on a future episode because there was so much more for us to chat about, but we had to find a closing point. He's truly a great resource for public health. I encourage you to connect with him, learn more about the work that he's doing, especially explore what he discussed with us in his collaboration with Quant16 and other programs that we discussed in this episode. You can find all the links to connect with him on the show notes page for this episode. The show notes page for this episode, which is episode 352, can be found at phecpodcast.com. Now, once you're there, just navigate to episode 352 and you'll find the show notes, which is a summary of everything we discussed and all of the links. Now, there's one more thing before we go. Please take a moment and share this episode with someone in your network. I'm sure they would be interested in hearing this conversation as well and would find this very resourceful. If you're listening right now in one of the podcast apps, then you can easily share this episode through a text or directly to social media. At the bottom of the show notes page, you'll also find social media sharing buttons, which make it super easy to share this episode with your network. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening to the Public Health Epidemiology Conversations podcast. Visit phecpodcast.com to find the show notes for each episode and to learn how to work with me.